So pregnant women with pelvic girdle pain often have a strategy where they overuse their pelvic floor to stabilize their pelvis. So as we start to train the abdominal wall and we give their pelvis some support with the pelvic belt, we also need to teach them how to release the pelvic floor, both for reducing their pelvic girdle pain and also in preparation for delivery. So how do we do that? We can start by using a very soft ball such as this, deflate it a lot, and then have them come and sit on the ball such that their pelvis drapes from side to side and front to back over the ball. You want the ischial tuberosities, or the sitting bones, to actually be in contact with the chair. Then you know you have the ball deflated enough, okay? So come on in, have a seat. And you can place that ball wherever it's comfortable for you, but I don't want it wobbly. I want you to sort of feel really, really secure on the ball, okay? All right, so one of the things that we know is that the pelvic floor should react to pressure. So we can increase pressure in the abdomen by pretending you're blowing your nose. So just plug your nose, blow. And what did you feel your pelvic floor do when you did that?
Push down.
Push down. And it shouldn't do that. It should react by resisting that pressure. Okay? So now let's connect to the pelvic floor, stage 1 pelvic floor training. So tighten the muscles around the anus, and then just think about drawing the anus towards the back of your pubic bone. Now, as you do that, you should feel your low belly lift. Keep that, and now repeat the blow of your nose. Increase the pressure, and what do you feel your pelvic floor do?
It didn't move.
It didn't move at all. That's perfect. Okay, so now to practice that whole resistance to pressure, increasing in pressure, this would be a good exercise for you to do, where you practice lifting the pelvic floor and then adding a little bit of resistance to it. So this would be stage 2 training for your pelvic floor, making sure it doesn't descend as you increase pressure. All right? Now, with pelvic girdle pain, we may not want to do this. So that would be done if you had a non-responsive or a weak pelvic floor. So that may be something that's useful to do postpartum. In this stage of pregnancy, you want to learn how to let your pelvic floor relax and descend, and then to be able to use your diaphragm to increase the intra-abdominal pressure in preparation for delivery. Okay? So as you take a nice big lateral costal breath in, feel your pelvic floor descend onto the ball. And then as you breathe out, connect to the abdominal and feel your pelvic floor lift up off the ball. Breathe in sideways here. Pelvic floor should descend. And as you breathe out, feel the floor lift up off the ball. So the pressure of the ball gives you that sensory input to know if you're doing it right or not. Okay? Now, in preparation for delivery, we need pressure. We need pushing from your abdominals and your diaphragm with an open, relaxed pelvic floor. Not a shut-off one, but one that can eccentrically lengthen. Okay, so how do we do that? Take a big breath in, let your pelvic floor descend, plug your nose, and now bear down, push down with everything you've got, but let your pelvic floor stay descended. It should really push down into the ball. Hold, 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 and they're going to say, push mama, push mama, push mama, and then relax. Okay? So a very different thing to practice, which will help you prepare for relaxing your pelvic floor, using the diaphragm and your abdominals to push, so you have a better chance of having a successful vaginal delivery. Okay?